Welcome to Sterixa IPAC Consulting. We are a physician-led infection prevention and control service dedicated to supporting healthcare facilities with expert guidance and tailored solutions. At Sterixa, our mission is to protect patients, staff, and communities by setting the highest standards in infection prevention and control. At Sterixa IPAC Consulting, our strength lies in the expertise of our team. Dr. Mohammadi is a board-certified infectious diseases physician, IPAC specialist, and professor of medicine at Western University, Ontario. She is the founder of Sterixa IPAC Consulting, bringing clinical leadership and a physician-led perspective to infection prevention and control. Dr. Shiva Bharati is a physician and health data specialist and a research coordinator at Mount Sinai Hospital in Toronto with over 20 years of international and Canadian experience in infection prevention and control. Her work focuses on outbreak management and respiratory infections, combining frontline knowledge with data-driven solutions. Sterixa IPAC Consulting provides physician-led services across a wide range of healthcare and community settings. We support long-term care facilities, hospital-based IPAC programs, social services, and obstetrics. Our expertise also extends to dentistry, endoscopy, chiropody, and podiatry, as well as outpatient surgical centers. Each setting comes with unique challenges. Our approach is adaptable, ensuring solutions that meet your specific needs. Long-term care homes in Ontario are legally required to have an infection prevention and control program under the Fixing Long-Term Care Act, 2021, Section 23, and Ontario Regulation 246/22. The program must be comprehensive to prevent and control the spread of infection. Homes are responsible for ensuring staff receive appropriate IPAC training. They must also implement all standards and protocols issued by the director regarding IPAC. Finally, IPAC programs must be evaluated and updated at least annually and more frequently during a pandemic, based on evidence-based practices. Sterixa IPAC Consulting provides specialized infection control consultations to address your most urgent and complex needs. We support facilities in managing suspected transmission events and unusual exposures. Our expertise includes tackling multidrug-resistant organisms and complex infection control cases. Beyond routine policies, we offer guidance on patient and staff safety concerns, ensuring every recommendation is evidence-based and physician-led. Our practical solutions are tailored to protect patients, staff, and your organization with the highest standards of infection prevention and control. You should turn to Sterixa IPAC Consulting when your facility faces complex infection control challenges. This includes concerns about possible staff or patient exposure, reviews of multidrug-resistant or resistant organism cases, and questions about appropriate isolation or cohorting. Our expertise is also valuable when clinical care and infection control decisions intersect, requiring both perspectives. And when cases raise concern for a possible outbreak, Sterixa is there to confirm, guide, and support outbreak management every step of the way. Sterixa IPAC Consulting offers structured infection rate audits to strengthen your infection prevention programs. We provide regular virtual IPAC audits to ensure compliance and identify gaps, always prioritizing safe environments for patients, residents, and staff. Our audits include an objective review of core practices such as hand hygiene, environmental cleaning, PP use, isolation precautions, and policies. Each evaluation is physician-led, highlighting both strengths and risks, and concluding with actionable strategies for continuous improvement. Infection rate audits are most valuable during key moments in your organization's cycle of care. They can be used for routine quality assurance or annual IPAC program evaluations, as well as preparation for Accreditation Canada or ministry inspections. Audits are also essential following an outbreak, helping identify gaps and prevent recurrence. When staff turnover or leadership changes occur, external physician-led review ensures continuity and consistency. And above all, Sterixa provides objective, physician-led oversight of infection control practices, tailored to your facility's needs. Sterixa IPAC Consulting provides rapid, physician-led support for suspected or confirmed outbreaks. Our coverage includes influenza, norovirus, scabies, COVID-19, group A strep, and many more infectious threats. We follow a structured response framework, guiding facilities from the first suspected case all the way to outbreak resolution. Every response is aligned with provincial and national standards, ensuring best practices at every step. Most importantly, our coordinated control measures protect residents, patients, and staff, keeping safety at the center of outbreak management. Outbreak control services are essential in situations where quick, evidence-based decisions are critical. They are needed when suspected or confirmed outbreaks arise, whether respiratory, gastrointestinal, scabies, or multi-drug resistant organisms. Our expertise helps when multiple cases raise concern for transmission within your facility, or when there's uncertainty about when to declare or resolve an outbreak. Sterixa provides a structured, physician-led outbreak management framework, ensuring consistency and accountability. We also support facilities in meeting requirements for outbreak documentation and compliance with public health standards. Why choose Sterixa IPAC Consulting? Because our services are physician-led, backed by board-certified infectious diseases expertise. Our recommendations are grounded in evidence-based practices, aligned with PIDAC, PHO, CDC, and WHO standards. We deliver rapid response with tailored, practical solutions, ensuring your facility has the support it needs when it matters most. With experience across long-term care, hospitals, retirement homes, and community care, Sterixa brings trusted expertise to every setting. Above all, we are your partner in ensuring compliance, safety, and outbreak readiness. The professionals at Sterixa provide a range of supports to strengthen infection prevention and control in long-term care homes. We begin with a thorough assessment of residents, their preconditions, and medical interventions, paying special attention to the type and frequency of infections, their preventability, and mandatory reportable elements such as antimicrobial resistance and ventilator-associated pneumonia. Ongoing case finding is done through close contact and feedback from frontline workers. We provide electronic data sheets that allow facilities to store data and calculate healthcare-associated infection rates accurately, reducing the errors that come with manual calculations. We calculate incidence density rates to help maximize infection prevention and optimize resources. Data is interpreted in a meaningful way. For example, an increase in infection rates should immediately trigger an investigation and corrective action. We also support communication of surveillance data and conduct periodic reviews of the surveillance system to ensure it remains effective. Altogether, these functions save valuable time for IPAC leads, allowing them to focus on their critical responsibilities while improving the overall quality in your facility. Submitting a consult with Sterixa IPAC Consulting is simple. First, go to sterixa.ca and click on Request a Consultation. Next, complete the consultation form provided and email it to info@sterixa.ca. Our team will review your request and respond promptly, providing the support your facility needs to stay safe, compliant, and outbreak ready. Thank you for considering Sterixa IPAC Consulting. We are here to support your facility with physician-led infection prevention and control expertise. For more information, visit us at sterixa.ca, email info@sterixa.ca, or call 519-280-3590. Sterixa, your trusted partner in infection prevention, compliance, and outbreak readiness.